uh, some of my favorite folks that I get to talk to all the time are future LVTs and again, like the folks that are going to shape the industry for us. So I'm really excited to share my experience as well as some what I find to be pretty helpful uh, tips and things to remember as like you guide through your success as a veterinary nurse. I used to kind of call these like um, I used to call these the things I wish I knew, but I think that I still think about these today and remind myself. So these are, I think, my 8 rules to kind of help guide success as a nurse in the field. Um, I'll start off by introducing myself. So I am Jesse. I'm an LVT. I initially joined the field in 2013. I am from Rochester, New York. And I originally went to school to SUNY Cortland to pursue my degree in social studies education. I wanted to be a history teacher to high school students. I then did my first student teaching session and immediately was like, this is definitely not for me. Just because I really love I was like, I just wasn't giving me the passion that I wanted. I was like, yeah, maybe I'm not going to be a teacher. And then I found like, lo and behold, like becoming a nurse, a lot of what you're doing is teaching. So I was able to like eventually flex into that even more. But at first, wasn't for me. Wanted to find something else. So in 2013, a friend of mine got me a job at a general practice as a kennel attendant. Um, at that time that was like the first entry point to the veterinary space. Didn't think about it really before then. Didn't see it as an option for a like viable career outside of just like becoming a veterinarian. But once I was introduced to the nurses and techs that I got to work with, I immediately was kind of enamored with that role and found a way to make it happen. So I started school in 2014. At that same time, I was exploring more like other parts of medicine, what I wanted to pursue as a technician. ER was very like attractive to me because it is something it had all of the great things I loved about medicine of like the troubleshooting, the problem solving in a group setting. It was very like just I mean, obviously very fun, lots of different, you don't know what's coming in each day. So I wanted to expand my horizons, go to ER. So I went to ER at the same time I applied and got into my program, which was at Madai Buffalo. Um, I went there all through, I worked all through the time I was in school as I wanted to help be sure that I was kind of like applying the things I was learning as I was continuing on. Um, at ER, like I said, I really fell in love with it. It became something that, like to this day, consider myself an ER technician. Um, Eventually, throughout the program, I did also find, again, I'm somebody that like I like to explore different everything that's out there, see what I like and what I mesh with most. And I started working at a low cost, low income clinic in the central city of Rochester, New York, where then I really fell in love with that kind of medicine, the connection to the community we have. That were offering services to like those that normally couldn't afford it or couldn't gain access to it. I really like appreciated the client education perspective. Like I said, at first I was like, I don't want to talk or teach people. Now that's all I do really. And I think that that is like, it's something that I love a lot, especially as a nurse and technician. But through that nonprofit work, through that community guided medicine work, I graduated in 2017 and decided I wanted to move on from Rochester. At the time, it was still quite like difficult for technicians to um, advocate for themselves from a salary perspective, benefits. It wasn't really clear, like trajectory of where we could go, especially if we wanted to continue practicing medicine. I think what we'd always see is either like kind of an administrative or managerial position that would take you off the floor or pursuing a VTS, which at the time when I just graduated, I wasn't like sure which specialty I'd want to go into if I wanted to do that, but I wanted to continue down community care. So I decided to pack my things and move down to New York City. I worked at the ASPCA Animal Hospital in the Upper East Side, which is a kind of like a mecca of all things shelter med, community medicine. I was able to expose myself to so many different types of cases. I worked with the NYPD and did a bunch of like hoarding cases, abuse cases. Those were obviously super, super difficult, not for the faint of heart. But I really loved the reward that I felt through going there and kind of again, the motto there is giving a voice to the creatures that don't have one. So that truly felt what it was like because we were able to really take care of like any pet in the community at that time, especially even ones where like I was deployed a couple of times to bring in pets from other states and other like bad situations. So it was really, really eye-opening to for me as a tech of just what like I truly was capable of. Um, but as what happens sometimes or had happened sometimes in this industry is that and I recall my first day of classes working in like a orientation course with our dean and our dean kind of addressing my class on our first day kind of saying the average lifespan of a technician in the career, so in our field, is about 5 years. 5 years before they kind of just move on, either from the field altogether, from practicing, from using the license that they're achieving or working towards at that time, which to me was shocking. And unfortunately, it only has gotten a little bit higher, where I think now the average career span of a nurse is about like 7 years. I think obviously there are tons and tons of amazing nurses that stay in the field much longer, but our average is starting to creep up, but still quite low, honestly. So for me, that was, like I said, super shocking. How can I be spending so much time, effort, and energy just for me to not want to be there in like less than half of a decade? So I kind of ignored it. I said, well, I don't think that will be me. I don't think that will start to feel that way. And by the time I was kind of finished with my 2 years, 2.5-ish years at ASPCA, I was feeling that way. I was feeling burnt out. I was feeling a little bit like it was just challenging to continue to move up in my role and expand what I saw as like my utilization and how I can continue to build a career within veterinary medicine. It felt like I hit that ceiling so quickly, which is something that like a lot of technicians feel, especially when you're a little bit discouraged by having a challenge like a challenge to make roles for you, to find roles that fit your needs as well as the clinic's needs, and even just like salary and stuff like that. Like, what does that look like for us, and how does that continue to be livable as a technician, especially living in New York City? So, in 2019, I saw an ad for Bond Vet, and at the time, I was so skeptical because it was really novel what they were offering when it came to a focus on culture, building something. At the time they just opened their first clinic in Cobble Hill, Brooklyn, in August, July of that year. And I was just seeing this ad about like a month later. So really, they have proven nothing at that time. It was a complete gamble. And but when I first sat down with our founder, Dr. Zay Sachu, she totally like spoke to me and in a way that I felt so heard and respected and appreciated. And that to me was so important. I care so much about the people that I work with, the industry that we're in, and to be in an organization that only wants to see those people flourish and grow and support in any way that they can. That was my jam completely. So I took the leap to jump into Bond in 2019. I was a nurse on the floor, and that's when I was introduced to urgent care. Urgent care at the time was still very novel. Even now, I think there are more popping up, but back in 2019, it was still like kind of just now starting to make waves. And I think what's great about urgent care is that it's like from coming from ER, it supports so much of the ecosystem of veterinary medicine. When we think about how human urgent cares exist in a medical space, it takes load off of an ER. Likely in my experience, a lot of the cases in an ER can be seen in an urgent care clinic. They're not true emergencies. You know, ER should be for those trauma cases, those cases requiring specialization, like our urgent care practices that I practice in today. We do everything up until, blood products. We stabilize. We're able to handle, pretty complex stabilizations and getting everything up to speed at a much lower cost. ERs, I'm sure you all have either experienced or hopefully not with your own pets, but I've seen it while being out in the field. ERs are expensive and that service can be really limited. And so adding more different types of practices to our industry, to our field makes it, again, a lot more accessible for care. And as you already know, my background in nonprofit and ASPCA work, I really care about accessibility. So I was all in on Bond, and I joined as a nurse on the floor. And in 2020, I was asked to join the medical operations team. And this is when I already kind of felt, obviously, like my voice was being elevated and heard through this time. But when I joined the medical operations team, that to me was a show of so much trust in our technicians, in and me as a technician, obviously, but that this organization was continuing to put veterinary voices at kind of every level of the organization. Um, as a medical operations manager, I was able to do things that I never thought I was going to do in this field. I organized and held an accredited CE conference in New York, which was crazy and super fun. And I got to meet so many people, so many awesome educators and nurses, doctors alike. I hosted a podcast on the floor at New York Vet and still have that podcast. You can look it up. It's called Bond Air. I've talked to so many people. I've developed training programs and curriculums for our teams, our doctors and our nurses. I've informed our pricing in many ways. I've informed how we look at the skill sets of our nurses and develop them out. I think it's something that, like, having a technician, somebody that's been on the floor, has done these things and still do these things. I have 1 to 2 clinic days a week where I still jump in the clinic, work on the floor with everybody across all of our clinics. So as well, I think you can see some of these pictures. A lot of these pictures are from Bond. Our clinic design, we build all of our clinics from scratch, so they're built with our team in mind. That same still sentiment of how is a technician going to flow through the space, how is a doctor or a patient going to flow through the space is being considered. We're kind of not just like, finding an old mom and pop and slapping on a new coat of paint. We're truly investing and building in these clinics just as much as we are our teams. So through my stint as a medical operations manager, at the end of last year, I was offered the position of our very first director of nursing. So through that, one of my missions in joining that was starting the relationships that we're talking about today. So working with students, I see you all as the next generation of veterinary medicine in the same way I was now almost 10 years ago, coming into the field and pushing for change and advocating for change to make sure that we continue to be a sustainable career. My goal in this place is to extend that average lifespan of our nurses to make sure that we remain kind of a career that is viable for everybody if you want to be in it, and welcoming to everybody as they come in. So I'm super excited to get into this all today. I will explain some of these pictures. That top left, that's my cat. His name is Clawson, of course, because he is my son with claws. He is a menace. I think he's passed out behind me right now. But I grew up with dogs always, and then I started working with cats and fell in love with their unique personalities. And of course, the cat that I ended up with now 9 years ago, Clausen, I train him like a dog. So he sits, he follows me around, he does everything a dog would do, except for he's a little bit more aloof and not as excited when I come home. On the bottom picture there, that's me and a couple of our technicians and doctors as we were hosting we did a dentistry wet lab. So this was one of the things that was really cool. We have a dental VTS on staff. Her name is Sheena Davis. She's one of like I think there's like 7 or 8 dental VTSs in all of New York State. So we were super, super honored to have her work with us and continue to work with us and still hold a lot of, we actually have a training later this week that she's doing with us. She's taught me a lot about dentistry. As I said, I am an ER technician. Dentistry was totally not my jam. I didn't want to touch teeth, but now I've grown to really appreciate scaling, polishing, radiographs, doing all of that stuff, and finding a lot of satisfaction in being able to see, a pet coming in with a really painful mouth and leaving and hearing the story of the owner being like, oh my gosh, my cat's completely different now. I didn't even realize he was so uncomfortable. So this day we got some cadaver heads and we were able to train everybody through getting everyone more comfortable. So these are we do things like this truly all the time because and I'll talk about it a little bit later. Like we don't stop learning at school. We don't stop learning once we leave that practice after year 1, year 2, year 3, or 4. We continue to grow. So a lot of what we do at Bond is invest heavily into the education programs that we have. It is not my goal at all to ever have a technician feel like they're just thrown into something and not have support. We're continuing to build those supports as we go along. Speaking of support, this picture on the bottom here is actually very recent. This was um, a couple of weeks ago. I was meeting with all of our lead nurses in the New Jersey region. So these are our lead nurses out there who, to me, was so excited because I've known all of them since they started with us, and they've continued to kind of grow in their leadership skills. They were all nurses that kind of came to me unsure of that they were capable of this. So I like, of course, they all are, and I am here to be like their cheerleader. That's like what I do for them all the time is advocate for them and ensure that they have what they need to support their teams. And they've grown so much. And this is like just a good scene that I'm always really proud of seeing these really awesome, confident nurses continue to flourish and grow in their careers and get more and more experience. So um, all that to say is like my journey has been it's still going on, it's still ongoing. I'm still continuing to learn from a lot of the technicians, doctors, everybody in our field. And I can't wait to learn from you guys soon. As we mentioned, we are offering externships, summer placements. So you can scan this, it'll take you to a little form if you're interested. Just indicate what you're interested in. I'll flash this again at the end, but we do offer payment for our externs. That was something that was really important to me as we set up this program. I want to make sure that we show all of these students how much we value your time and what you're giving to the industry as a whole. So feel free to scan this, reach out. My email is super easy. It's just my first name @BondVet. Happy to chat, talk about your journey and what you're looking for, all of those things. But without further ado, let's get into the 8 rules. So rule number 1, as you can tell already, I'm like always bringing energy. I think that as a technician, as a nurse, you are always, coming into a clinic and you definitely don't know where you're coming into some days. Obviously, you're carrying stuff from outside of work. I think everyone's lives are always so crazy, and it's hard to just like remember and remind ourselves to like just like we're here right now. Let's just like be present as much as we can. And I think that your teams usually appreciate that a lot, especially as a nurse, as you are the one that is kind of helping um, bring all of the operations, all of the treatments, all of the cases through to completion with your team. So just like as simple as a smile, get like we do a lot of stuff to get pumped up in the day. We'll have a huddle in the morning, and sometimes it'll be like a fun icebreaker. Sometimes I'll walk into clinics and there'll be Ice Spice music videos blasting on the TV. It's just like it's just anything to get the vibe going for the day. Because once we're there, I think it's important to kind of be focused and be there for the patients. On the right-hand side of the screen is our team celebrating actually our impact goals. Our impact goals are something that we set up at Bond to be able to kind of share in the success of a busy day with the team. So the more cases that are coming through and workups and other like kind of achievements throughout the day adds to their impact score. And that impact score, once their goals are hit, actually all of the support staff, so our VAs, our veterinary assistants, and our nurses are able to share in a little bonus that they get that day. So they'll get like a nice little payout. That's a portion of the profits that were brought in that day because we want to, again, share in the success of what we're doing here and of what we're building. So I always like to share that because it does bring a lot of energy throughout the day. I think seeing the confetti go once you hit that, everyone always does like a fun cheer. Even in the middle of like chaos, somebody will look up and say like, "We got confetti." So I think that's like still that energy that we're always trying to bring. Rule number two, and this is something, again, that will always, always be of the utmost importance for you all, to advocate for your patients. I think it's very scary when you first go into the field and there is just, a little bit of rocky confidence, especially if you're like an ER or you're anywhere and you're starting to question, what treatments are being given, or maybe there's a miscalculation, or maybe there's something about this case that the doctor misheard or didn't hear. I think the thing to remember is, as a nurse, a technician, and you're working on these cases, you're going to be super close, especially if you're in an ICU or on an ER floor. You're going to be super close to this patient while this doctor is running around, speaking with clients and getting, stressed, especially if you're working with new graduate doctors, even more so. To ask you to be even more kind of on top of them because they are also learning and also nervous and building their confidence. So advocating for your patients, if you see something, say something. It's always, always important. It like to be that voice for your patients. Don't be afraid to ask questions or to like offer as long as, again, it's in a really respectful way. I think we're all trying to learn, and sometimes if we're questioning something so abruptly and abrasively, it can create defensiveness amongst clinic team members. So we always want to approach that, again, with the kindness, the curiosity that comes with advocating for our patients. So I always want to call that out. You guys, the nurses, are the most, educated on the floor with your patients. So always, always, always advocate for them. While you're doing that, don't forget to advocate for yourself. This is something, again, as you build confidence in your skills, in how you feel in the industry, you'll begin to recognize how important it is to advocate for yourself, finding time, finding opportunities to learn and grow. That should always be at the top of your mind. So in this picture on the left are a bunch of our new graduate doctors completing the MAID program, which is a new graduate training program that we have, nurses, medical directors, clinic leaderships. It was something that I always think about when we think of advocating for yourself, because I think all of these new grads and these doctors, as they continue on, they start with us, they have to learn that skill just as much as all of us do. So advocating for yourself throughout your journey is extremely important, and putting that learning and that education first is really important. Big role for us in the industry, as you'll continue to hear throughout your time, is ensuring you're being properly utilized. As you complete your program, sit for your boards, and then hooray, congratulations, you are licensed. You are now able to do quite a bit. So ensuring that you're properly utilized and operating at the top of your license is extremely, extremely important, because you want to add, like, you always want to be used and add to the value that you're giving to clients, that you're giving to the pets, because you are capable of a lot. And I want you all to remember that you're so capable of like everything in these clinics. My favorite thing about this slide is that center picture. That picture, every single person you see in that picture is a technician. Besides Dr. Lee back here in the scrub cap, everyone here is a tech. And that to me makes me so happy, because this is true utilization. We are stabilizing patients, or we're running anesthesia, we're prepping things. We are getting CRIs together. This day we wanted to, like, I mean, you all know at this point my love for the shelter med, high volume, low cost models. One of the first things I did was bring in a bunch of rescues to get all of our ORs and set up in our team feeling comfortable with surgical flow and training. So we had a bunch of rescue cases come through, and did a big spay and neuter day for like little to no cost to the fosters and the rescue, that we were able to set up. And this day, the doctors were far outnumbered by the techs, and that was so fun to see. And everyone feeling, so utilized in their role. They're always moving. They're doing more than just restraining during an exam or just kind of following through on the tasks that are given to them from the veterinarians. They are truly using all of their skills here. We push our teams to help assist in creating protocols for our anesthetic cases. We always work with that technician in mind of how we can make sure that, as you're growing through your career and you're gaining confidence, you're still able to keep pushing and learn more. So always, always, always aim for utilization when you can. My friend on the left here, she is in the middle of a dental, and I like this story too because she came from similar to me, ER background, and was very scared of dentistry. Didn't really want to touch it, but like upon like speaking with her a ton and just like building that confidence up, getting her to the point where she feels like now she is the one in her clinic advocating and pushing to get dental cases in. She's working dental days. This is in our Upper East Side clinic, East 86, and she is incredible and has now helps train and push techs around her. So I'm really, really proud to see that continue to grow. Speaking of, these all play into each other. Always learning and growing. Like I said, your learning does not end when you graduate, it does not end when you pass your boards, does not end after year 1, year 2, year 3. You will constantly, constantly, constantly be growing. What I've learned to love a lot about urgent care is it attracts team members from so many different walks of life when it comes to their veterinary journey. So because we're urgent care, we'll have ER doctors that are coming through, or ER nurses that are coming through that are thinking about, a different pace, a more manageable pace. You have general practice doctors and nurses coming in, kind of seeking out a little bit more expanded caseload and expanded case types. And that to me has created this environment where like there's so much humility, there's so much respect for each other, and there's so many questions. It is like a place where nobody feels shy to ask questions. And even me, like I was telling the group earlier, just a couple weeks ago, I was in a clinic and doing a nurse appointment. I had needed to give a CIV booster. And the first thing I said immediately out loud to everyone on the floor was, where do I give this? I have not done this in so long, giving one of those. So there really is no shame. We want to help each other. We want to learn from each other. And that is something that's always, always important, is to, as you gain skills, don't gatekeep those skills, train people, work that up. You have all been baby nurses at some point, so we want to continue to grow and expand that and have that type of culture in our space. I put Tyson on here. Tyson is that beautiful pitty on the right hand side. He is getting an acupuncture appointment right now in this photo. We had a clinician come start with us that was certified in acupuncture. A lot of the techs wanted to learn more about this service and how we can properly utilize it. Tyson came in for chronic back pain, and has been receiving acupuncture treatments with us now for the past couple of months. He is doing great, and our team loved to learn this new practice of medicine that we didn't have previously. And that's something that at Bond, we are always like trying to iterate and grow. We operate a lot the way the industry and medicine operates, is that it's always changing. There's always a new report out. There's always new research. So we're not really in the business of setting it and forgetting it. We always want to continue to iterate. So bringing in new services based on interest, things like this are really important. I just spoke to a team of radiologists that I want to try to bring in to get our technicians more comfortable with image capturing on the ultrasounds in like the level of like sonographer to be able to help capture those images for our team to view and also radiologists to review. I think that again, thinking about growing, thinking about utilizing at the top of our license. I mean, the rules are very clear. We can't diagnose, prognose, recommend, like prescribe, all those things we know, but we can do a lot else. So always, always, always pushing for that for our nurses. Number six, arguably one of the most important ones in our field, practicing mindfulness. It is very easy to let this slip as you're going throughout your career. I remember working at the ASPCA and having, 24-hour shifts, pushing like really hard and thinking that, this is just part of it. This is just what I'm supposed to be doing. And forgetting that, forgetting to take time for myself, forgetting to take time to connect with my team outside of the intensity of what we're doing rather than, focusing so much on trauma bonding, focusing on building up each other and growing with each other and even just having that time for ourselves either throughout the day or outside of work. I am somebody that is a big advocate for healthy hobbies. I run, I ride bikes, I do yoga, I hang out with friends, I go to concerts, anything that I can do both with my team at Bond, without. I think it's really, really important. And we try to make sure that we're all taking care of our brains throughout the day. So I have come into clinics before where the team is doing like maybe it's the lunch break and the team is doing group stretching and I can't find everybody because everyone's on the floor. Or, giving a great big hug like our Hoboken team in the center picture here. But I think it's really, really important to just look out for each other and advocate for each other. Can get away from you really quickly before you even realize that's becoming an issue. So don't be afraid to talk about it. There are lots of really good resources out there for technicians. I just started volunteering for a group called Mentor Vet. If you all look it up when you're at like after graduation, it's a service where they match you up with somebody as a mentor to kind of like be like a pen pal or a phone buddy to hop on once a month and talk about how you're doing post-graduation, how things are feeling. Definitely use your resources. There are tons out there. Rule number seven, in that same sphere of like advocating for each other and yourself, make sure you're pushing those around you. I think it's so important to build each other up and to we're all in this industry together. So if you have folks around you that are feeling, a little bit disconnected, disengaged, or uncertain of their skills and what they're doing, be their cheerleaders, support them. I love this picture on the right. This is our Park Slope team saying goodbye to one of our veterinary assistants pursuing her DVM. So like I love seeing the support to be able to, again, keep pushing folks into the next phase of their journeys. On the left, love this. These are two doctors from our Astoria clinic. That's our medical director and one of our associate vets. They have been wanting to get to work up their venipuncture skills a bit more so they can be more helpful throughout the day when the techs are busy doing radiographs or anesthesia or something like that. So they were very excited to jump in and get a little bit more practice there. So wanted to show that as we continue to push, not everybody is exempt. Everyone is allowed to be pushed around you. And the last and final rule, potentially the most important, is just to have fun. We like having fun in our clinics, and I like having fun in the clinic. I think having a day where everyone's just is continued to be like stressed and down is really, really hard for anyone involved. So it's important to, sprinkle fun things throughout the time to advocate for it. The most fun that I have in my current job, my current role is once a week, or sorry, once a year. The best week of the year is Vet Tech Appreciation Week in October. one of the things that I advocated for when starting at Bond was making this a bigger deal than I've experienced in the past. In the past, you get your pizza party, you get maybe a card or a gift card or some acknowledgement for that one day of the week, but then you kind of move on and you go on from there. But I wanted to make it a much bigger deal. So we spend the entire week from Sunday to Sunday celebrating our nurses through tons of different events. This past year, we did a big virtual scavenger hunt across all 46 of our clinics. The picture on the right, it was one of them. One of the tasks was to take a whole picture of the whole clinic dabbing. I have so many now like blackmail pictures, embarrassing photos of everybody because they did all of this. But it was super fun to do. In the center photo is one of my favorite photos of I think my entire career is one of the things I added to the Vet Tech Appreciation Week was our Nurse Awards. So we now have an annual Nurse Awards. This 2024 will be our 4th year of it. Those awards are all chosen by their teams. We do a big ballot. They're able to advocate for who they think has the best venipuncture skills in their clinic, has the best ER skills in their clinic, best at talking to clients, like most. Well, I have one that's just like a glow getter who in their clinic is like the most brings the energy, brings the positivity when they need it most. And this center picture is our lead nurse in the Upper West Side. Her name is Kenny Davis. This is her reaction to winning the Bond Vet Nurse of the Year award. That is something that we give out to, at this time when we only were in New York, it was our entire company. But as we've grown, we now have Nurse of the Year in each of our regions. And Kenny winning this, I think, was so important and empowering to her. She went on to now is managing multiple clinics in our New Jersey sphere. This was a couple of years ago that she won this award, and she brings that trophy everywhere with her and reminds me constantly that I selected her for that, or that her team selected her for that rather. So I really, again, appreciate having these moments because this is kind of all what it's about when you're in it with each other. After that, I want to just share some of our cultural values at Bond because I think there are really important. Number one, we're obsessed with pets. We use a messaging software in all of our clinics called Slack. And in that Slack, we have a channel called Good Vibes, and that's where all these pictures are from because we always want to share that we're just as obsessed with these pets as the owners are. Something that's really important that we always continue. We work as a team. As I've said a ton, we really focus on building each other up, working with each other, being very humble and asking questions. That's so important. We communicate clearly. This is something, again, that's even more important. We don't want things like when reviews happen, there to be any surprises. We want it to be as clear as possible as we continue to grow and to learn and to give feedback and receive feedback. Communicating clearly is always kind of gold star. We work happy. And like I said, this isn't just like coming into work, slapping a smile on your face. It's more so about supporting each other, helping each other out when they need, and just being aware of what everyone kind of needs to be happy is really important too. And we're empowered. This is something that I love. As I mentioned a lot already, we're a growing organization. We are constantly pushing our team to push us, and our teams are always sharing with us amazing ideas, lots of things that we implement ourselves and continue to grow from. So I love how much we've been able to grow a really empowered team and to see how that continues to flourish. So I will stop there, but again, feel free to scan this QR code. It'll take you to that information request form, fill it all out, and we'll get a conversation going. But thank you, everyone, for having me again. Happy to answer any questions about Bond, the presentation, my career, studying for boards, preceptors, whatever. Happy to answer.
Does anybody have any questions for him right now? It does not look like we have any questions. So I just want to thank you, Jesse, for joining us. This was great. And hopefully you'll hear from some students soon.
Awesome. Yeah, thank you all so much. I hope you have a good rest of the day.
You too.